Question 1. A licensed practical nurse, LPN, is caring for a client who underwent a total hip arthroplasty yesterday. The client reports sudden, severe pain in the surgical hip, and the nurse observes internal rotation of the affected leg and a shortening of the leg length. What is the priority action for the LPN? A. Administer prescribed opioid pain medication. B. Reposition the client for comfort and apply ice. C. Notify the registered nurse, RN, immediately. D. Document the findings thoroughly in the client's chart. Answer: C. Notify the registered nurse, RN, immediately. This question tests the LPN's ability to recognize a critical complication and prioritize reporting within the scope of practice. The keywords sudden, severe pain, internal rotation, and shortening of the leg are classic signs of hip dislocation, a serious postoperative emergency. While pain relief and documentation are important, the priority is to promptly report this urgent finding to the RN, who will then contact the surgeon for immediate intervention. Recognizing dangerous complications and knowing when to escalate care is a vital LPN responsibility. Question 2. A client diagnosed with chronic obstructive pulmonary disease, COPD, is experiencing dyspnea. The LPN notes the client's oxygen saturation is 88% on room air. The client has a standing order for oxygen therapy to maintain SpO2 above 90%. What initial action should the LPN take? A. Encourage the client to cough and deep breathe. B. Administer oxygen via nasal cannula at 2 liters per minute. C. Auscultate lung sounds and assess respiratory rate. D. Notify the registered nurse, RN, about the low SpO2. Answer: B. Administer oxygen via nasal cannula at 2 liters per minute. This question focuses on the LPN's immediate intervention based on a standing order and objective data. The key information is the client's low oxygen saturation, 88%, and the standing order to maintain SpO2 above 90% with oxygen. Administering oxygen is within the LPN's scope given the standing order and directly addresses the client's immediate physiological need. While assessment and reporting are important, the LPN must act on the standing order first to stabilize the client's oxygen level. Question 3. An LPN is reinforcing teaching with a client who has new-onset type 2 diabetes mellitus about foot care. Which statement by the client indicates a need for further teaching? A. I should check my feet every day for any cuts or sores. B. I will wear comfortable, well-fitting shoes and avoid walking barefoot. C. I can use a heating pad on my feet if they feel cold in the winter. D. I will trim my toenails straight across after I shower. Answer: C. I can use a heating pad on my feet if they feel cold in the winter. This question assesses the LPN's understanding of essential client education, particularly for diabetes foot care. The keyword need for further teaching indicates an incorrect statement. Clients with diabetes often have peripheral neuropathy, which reduces sensation and increases their risk of burns from heating pads or hot water because they may not feel the excessive heat. The other options reflect appropriate foot care practices that prevent injury and infection in diabetic clients. Emphasize preventing injury in clients with reduced sensation. Question 4. The LPN is preparing to administer an intramuscular, IM, injection to an adult client. Which site is most appropriate for administering a viscous medication that requires a large volume, e.g., 3 milliliters? A. Deltoid. B. Ventrogluteal. C. Vastus lateralis. D. Dorsogluteal. Answer: B. Ventrogluteal. This question tests the LPN's knowledge of safe injection sites and appropriate volume limits. The ventrogluteal site is generally considered the safest and preferred site for IM injections in adults, especially for larger volumes up to 3 milliliters or viscous medications, because it is free of major nerves and blood vessels. While the vastus lateralis can also be used, the deltoid site has a smaller muscle mass and is limited to volumes up to 1 milliliter, making it unsuitable for a 3 milliliters injection. The dorsogluteal site carries a risk of sciatic nerve damage and is no longer recommended. Question 5. An LPN is assisting with the care of a client who has a new colostomy. The client is upset and states, "I don't know how I'll ever live with this bag." Which therapeutic communication technique should the LPN use? A. Many people adjust well to colostomies over time. B. It sounds like you're feeling overwhelmed by this change. C. Let's focus on the positive aspects of your recovery. D. Don't worry, the nurses will help you manage it. Answer: B. It sounds like you're feeling overwhelmed by this change. This question assesses the LPN's ability to use therapeutic communication, particularly active listening and reflection. The client is expressing feelings of distress and overwhelm. Reflecting the client's feelings, as in "it sounds like you're feeling overwhelmed by this change," validates their emotions and shows empathy, encouraging them to elaborate further. Avoiding clichés, false reassurance, or deflecting the conversation allows the client to feel heard and understood, which is crucial for building trust. Question 6. An LPN is monitoring a client receiving a continuous intravenous 4 infusion. The LPN notes swelling, coolness, and pain at the insertion site. What action should the LPN take first? A. Slow down the 4 infusion rate. B. Elevate the affected extremity. C. Discontinue the 4 infusion. D. Apply a warm compress to the site. Answer: C. Discontinue the 4 infusion. This question assesses the LPN's ability to recognize signs of 4 infiltration and intervene appropriately. The keywords swelling, coolness, and pain at the insertion site are classic indicators of infiltration, where 4 fluid leaks into the surrounding tissue. The immediate priority is to stop the infusion to prevent further fluid leakage and tissue damage. After discontinuing the 4, the nurse can then elevate the extremity and apply a warm or cool compress based on facility policy. Question 7. A client with a nasogastric (NG) tube connected to low intermittent suction is complaining of nausea and abdominal distension. The LPN observes that there is no drainage in the suction canister. What should the LPN do first? A. Reposition the client to promote drainage. B. Irrigate the NG tube with normal saline as prescribed. C. Notify the registered nurse, RN, immediately. D. Check for kinks in the NG tubing. Answer: D. Check for kinks in the NG tubing. This question requires the LPN to troubleshoot a common problem with an NG tube. The client's symptoms of nausea and abdominal distension, combined with no drainage, strongly suggest an obstruction in the tube. The first and simplest step in troubleshooting a lack of drainage from an NG tube is to check for kinks or blockages in the tubing itself, as this is a quick and common fix. If no kinks are found, then the LPN would proceed to irrigate the tube or notify the RN. Always start with the least invasive and most likely cause. Question 8. An LPN is providing care for a client admitted with acute exacerbation of heart failure. The LPN notes the client has crackles in the lung bases, dyspnea, and peripheral edema. Which prescribed medication would the LPN anticipate administering to address these symptoms? A. Metoprolol, low pressor. B. Furosemide, Lasix. C. Digoxin, Lanoxin. D. Lisinopril, Zestrol. Answer: B. Furosemide, Lasix. This question tests the LPN's understanding of common medications used for heart failure and their primary actions. The symptoms described, crackles, dyspnea, and peripheral edema, are signs of fluid overload, a common finding in heart failure exacerbations. Furosemide, Lasix, is a loop diuretic that helps remove excess fluid from the body, directly alleviating these symptoms. The other medications listed are also used for heart failure but do not directly address acute fluid overload as effectively as a diuretic. Question 9. An LPN is caring for an older adult client who is experiencing delirium. Which intervention should the LPN prioritize to ensure the client's safety? A. Orient the client to reality frequently. B. Encourage the client to ambulate independently. C. Place the client in a room near the nurse's station. D. Administer sedatives to calm the client's agitation. Answer: C. Place the client in a room near the nurse's station. This question focuses on safety interventions for a client with delirium, a state of acute confusion and altered awareness. Clients with delirium are at high risk for falls and other injuries due to their disorientation and fluctuating cognitive status. Placing the client in a room near the nurse's station allows for closer observation and more frequent monitoring, thereby enhancing safety. While orientation is important, ensuring immediate safety from harm is paramount. Sedatives should be a last resort, and independent ambulation would be unsafe. Question 10. The LPN is caring for a client who is NPO, nothing by mouth, for an upcoming surgical procedure. The client asks for a sip of water because they feel thirsty. What is the most appropriate response by the LPN? A. I can't give you water because it might cause complications during your surgery. B. You must not drink anything, but I can offer you ice chips. C. I understand you're thirsty, but it's important to follow the NPO order for your safety. D. A small sip won't hurt, but don't tell the doctor. Answer: C. I understand you're thirsty, but it's important to follow the NPO order for your safety. This question tests the LPN's ability to provide clear, empathetic, and rationale-based patient education regarding NPO status. The client's safety during surgery is the primary reason for NPO orders. Acknowledging the client's discomfort, I understand you're thirsty, while clearly explaining the safety rationale for the restriction is the most therapeutic and appropriate response. Offering ice chips would violate the NPO order, and giving permission for a small sip is unsafe and unprofessional. Question 11. An LPN is assisting with discharge teaching for a client with a new prescription for Warfarin, Coumadin. Which dietary instruction is most important for the LPN to reinforce? A. Avoid all green leafy vegetables. B. Limit intake of foods high in potassium. C. Maintain a consistent intake of vitamin K-rich foods. D. Increase intake of foods high in vitamin C. Answer: C. Maintain a consistent intake of vitamin K-rich foods. This question assesses the LPN's knowledge of client education for anticoagulant therapy. Warfarin's anticoagulant effect is directly affected by vitamin K intake, which promotes clotting. It is most important for clients on Warfarin to maintain a consistent intake of vitamin K-rich foods, rather than avoiding them entirely, to prevent fluctuations in the medication's effectiveness and maintain a stable INR level. Suddenly increasing or decreasing vitamin K can alter the INR and increase bleeding or clotting risks. Question 12. An LPN is assigned to care for 4 clients. Which client should the LPN assess first? A. A client 2 days post-appendectomy reporting mild incisional pain. B. A client with diabetes mellitus who has a fasting blood glucose of 140 mg per deciliter. C. A client with pneumonia whose oxygen saturation has dropped from 92% to 88%. D. A client scheduled for discharge receiving final medication reconciliation. Answer: C. A client with pneumonia whose oxygen saturation has dropped from 92% to 88%. This question requires the LPN to prioritize care based on ABC, airway, breathing, circulation, principles. A client with pneumonia and a dropping oxygen saturation indicates a potential respiratory compromise, which is an immediate threat to breathing and is therefore the highest priority. The other clients have stable or less urgent needs. Addressing a potential breathing problem first ensures the client's physiological stability. Question 13. An LPN is observing a new unlicensed assistive personnel, UAP, providing morning care. Which action by the UAP requires immediate intervention by the LPN? A. Assisting a client to ambulate to the bathroom without using a gait belt. B. Measuring a client's blood pressure prior to administering medication. C. Documenting a client's intake and output on the bedside flow sheet. D. Offering a client a choice of breakfast items from the menu. Answer: A. Assisting a client to ambulate to the bathroom without using a gait belt. This question evaluates the LPN's role in supervision and ensuring client safety. Ambulation without a gait belt for a client who requires assistance poses a significant fall risk and violates safety protocols. This action requires immediate intervention to prevent potential harm to the client. The other actions, measuring BP, documenting INO, offering choices, are appropriate duties for a UAP and do not pose a safety risk. Prioritizing safety is paramount in nursing. Question 14. An LPN is caring for a client with a new prescription for an opioid analgesic. What is the most important teaching point for the LPN to reinforce regarding safe medication administration at home? A. You may crush the pill if you have trouble swallowing it. B. Take the medication only when your pain is severe. C. Avoid driving or operating heavy machinery while taking this medication. D. You can stop taking the medication once your pain is gone. Answer: C. Avoid driving or operating heavy machinery while taking this medication. This question assesses the LPN's understanding of essential safety teaching for opioid analgesics. Opioids cause central nervous system depression, which can impair judgment, coordination, and reaction time, making activities like driving or operating machinery unsafe. Crushing pills depends on the formulation. Taking only for severe pain might lead to inadequate pain control, and abrupt cessation can lead to withdrawal. These are important but less immediate safety risks than impaired function while driving. Ensuring safety from potential injury due to impaired cognition is a top priority. Question 15. The LPN is preparing to administer medications through a client's percutaneous endoscopic gastrostomy, PEG, tube. After checking tube placement and residual volume, what is the next step the LPN should take? A. Mix all medications together and administer them simultaneously. B. Flush the tube with 15 to 30 milliliters of water. C. Administer the first medication slowly. D. Clamp the tube and document the procedure. Answer: B. Flush the tube with 15 to 30 milliliters of water. This question tests the LPN's knowledge of proper medication administration technique via a PEG tube. After verifying tube placement and checking residual volume, the tube should always be flushed with water before administering medications. This clears the tube, preventing clogging and ensuring the medications are fully delivered to the stomach. Each medication should also be administered separately, with a flush between each medication and after the last one. Question 16. An LPN is caring for a client who is experiencing a generalized tonic-clonic seizure. What is the priority nursing action during the seizure? A. Place a padded tongue blade in the client's mouth. B. Restrain the client's extremities to prevent injury. C. Turn the client to their side and protect their head. D. Call for immediate assistance from the healthcare provider. Answer: C. Turn the client to their side and protect their head. This question assesses the LPN's immediate actions during a seizure, prioritizing client safety. The most critical actions during a tonic-clonic seizure are to protect the client from injury and maintain a patent airway. Turning the client to their side helps prevent aspiration, and protecting the head cushions it from impact. Never place anything in the client's mouth or restrain their extremities, as these actions can cause further injury. Question 17. The LPN is collecting data from a client admitted with a urinary tract infection, UTI. Which finding is most important for the LPN to report to the registered nurse, RN? A. Cloudy urine with a strong odor. B. Reports of dysuria, painful urination, and urgency. C. Flank pain and a temperature of 101.8 degrees Fahrenheit 38.8 degrees Celsius. D. Increased frequency of urination. Answer: C. Flank pain and a temperature of 101.8 degrees Fahrenheit 38.8 degrees Celsius. This question requires the LPN to differentiate between common UTI symptoms and signs of a more serious complication. While cloudy urine, dysuria, urgency, and frequency are common signs of a lower UTI, flank pain combined with a fever, 101.8 degrees Fahrenheit, suggests that the infection may have ascended to the kidneys, leading to pyelonephritis. This is a more severe condition requiring prompt intervention and therefore represents the most important finding to report to the RN. Question 18. An LPN is caring for a client prescribed strict bed rest. To prevent complications of immobility, which intervention should the LPN prioritize? A. Administering a prescribed laxative daily. B. Performing range of motion exercises every 2 hours. C. Providing a high-calorie, high-protein diet. D. Applying sequential compression devices, SCDs, to lower extremities. Answer: B. Performing range of motion exercises every 2 hours. This question tests the LPN's knowledge of interventions to prevent complications of immobility. While all listed options address potential issues, performing range of motion exercises every 2 hours directly targets the prevention of muscle atrophy, joint contractures, and promotes circulation, which are significant complications of bed rest. SCDs prevent DVT, and diet and laxatives address GI issues, but direct mobility interventions are key for musculoskeletal and circulatory health. Regular movement, even passive, is essential when a client is immobile. Question 19. An LPN is reinforcing teaching with a client who has a new ileostomy. Which statement by the client indicates effective understanding of the teaching? A. I should expect my stool to be firm and formed. B. I will empty my pouch when it is about 2/3 full. C. I should irrigate my ileostomy daily to regulate bowel movements. D. I can eat anything I want now that I have the ileostomy. Answer: B. I will empty my pouch when it is about 2/3 full. This question evaluates the LPN's understanding of appropriate ileostomy care. An ileostomy produces liquid to semi-liquid stool continuously, so expecting firm, formed stool is incorrect. Emptying the pouch when it is 1/3 to 2/3 full prevents it from becoming too heavy, which could lead to leakage or skin irritation, indicating correct understanding. Ileostomies cannot be irrigated for bowel regulation, unlike some colostomies, and specific dietary adjustments are often necessary to prevent blockages or manage output. Question 20. An LPN is providing wound care for a client with a pressure injury. The LPN notes granulation tissue present and no signs of infection. Which type of dressing material would be most appropriate for this wound? A. Hydrocolloid. B. Dry gauze. C. Alginate. D. Debriding agent. Answer: A. Hydrocolloid. This question assesses the LPN's knowledge of wound care principles and appropriate dressing selection. Granulation tissue indicates a healthy, healing wound. A hydrocolloid dressing is ideal for wounds with granulation tissue because it provides a moist environment that promotes healing, protects the new tissue, and can absorb light to moderate exudate without needing frequent changes. Dry gauze would dehydrate the wound, alginate is for heavy exudate, and debriding agents are for necrotic tissue. Question 21. A client reports feeling lightheaded and dizzy while sitting up in bed. The LPN assesses the client's blood pressure as 90/60 millimeter of mercury and heart rate as 110 bpm. What is the priority action for the LPN? A. Administer a prescribed antiemetic. B. Assist the client to lie back down in bed. C. Notify the registered nurse, RN. D. Offer the client a glass of water. Answer: B. Assist the client to lie back down in bed. This question requires the LPN to recognize signs of orthostatic hypotension and prioritize safety. The client's lightheadedness, dizziness, low blood pressure, and increased heart rate upon sitting up are classic signs of orthostatic hypotension. The immediate priority is to ensure the client's safety by returning them to a supine position to improve cerebral blood flow and prevent a fall. After stabilizing the client, the LPN would then notify the RN and assess further. Question 22. An LPN is caring for a client with a new prescription for metformin, glucophage. The client asks, "Why do I have to take this medication with food?" What is the best explanation the LPN can provide? A. Taking it with food makes it work faster to lower your blood sugar. B. It helps prevent stomach upset, nausea, and diarrhea. C. Food helps your body absorb the medication more effectively. D. It prevents a sudden drop in your blood sugar level. Answer: B. It helps prevent stomach upset, nausea, and diarrhea. This question assesses the LPN's knowledge of common medication side effects and client education. Metformin is known to cause gastrointestinal side effects such as stomach upset, nausea, and diarrhea. Taking the medication with food helps to minimize these uncomfortable side effects. It does not primarily affect absorption rate, speed of action, or prevent hypoglycemia when taken with food. Question 23. An LPN is reinforcing teaching about fall prevention strategies with an older adult client. Which statement by the client indicates that further teaching is needed? A. I should get up slowly from a lying or sitting position. B. I will wear my slippers with good grip on the bottom. C. I will keep my room brightly lit, especially at night. D. I can leave throw rugs on the floor if they are small. Answer: D. I can leave throw rugs on the floor if they are small. This question evaluates the LPN's understanding of environmental safety and fall prevention. Throw rugs, even small ones, are a significant tripping hazard, especially for older adults. This statement indicates a lack of understanding regarding environmental modifications for fall prevention. The other statements, getting up slowly, wearing appropriate footwear, ensuring adequate lighting, are all correct and important fall prevention strategies. Question 24. The LPN is preparing to administer insulin to a client with type 1 diabetes. The client's blood glucose is 280 milligrams per deciliter. Which type of insulin would the LPN anticipate administering for rapid action to correct this elevated glucose level? A. NPH insulin, intermediate acting. B. Glargine insulin, long acting. C. Lispro insulin, rapid acting. D. Regular insulin, short acting. Answer: C. Lispro insulin, rapid acting. This question tests the LPN's knowledge of different insulin types and their onset of action. For an immediate correction of an elevated blood glucose level, a rapid-acting insulin like Lispro, Humalog, is most appropriate because it begins to lower blood sugar within 15 to 30 minutes. NPH and Glargine are slower-acting for basal control, while regular insulin has a slower onset than rapid-acting insulins. Question 25. An LPN is providing care for a client with a history of recurrent urinary tract infections, UTIs. Which dietary recommendation should the LPN reinforce to help prevent future UTIs? A. Increase intake of citrus fruits. B. Drink plenty of water throughout the day. C. Consume more dairy products. D. Limit cranberry juice intake. Answer: B. Drink plenty of water throughout the day. This question assesses the LPN's knowledge of practical strategies to prevent UTIs. Drinking plenty of water helps flush bacteria from the urinary tract, which is a fundamental and highly effective method of preventing UTIs. While cranberry products are sometimes suggested, increasing overall fluid intake, especially water, is the most universally recommended and effective dietary-related intervention. Citrus fruits or dairy products do not directly prevent UTIs. Question 26. An LPN is caring for a client who is agitated and attempting to pull out their intravenous 4-line. The client is disoriented. What is the most appropriate initial action for the LPN? A. Apply wrist restraints to the client. B. Ask the registered nurse, RN, to assess the client. C. Redirect the client with verbal calming techniques. D. Administer a sedative as per PRN order. Answer: C. Redirect the client with verbal calming techniques. This question assesses the LPN's ability to prioritize non-pharmacological interventions for client safety and agitation. The initial and least restrictive intervention for an agitated and disoriented client attempting to disrupt therapy is to use verbal redirection and calming techniques. Restraints are a last resort, and administering sedatives should only be done after trying less restrictive measures and typically with an RN's assessment and collaboration. Notifying the RN is important, but after attempting to de-escalate the immediate situation. Question 27. The LPN is preparing to administer medication to a client. After verifying the medication order and performing the 3 checks, what is the next critical step the LPN should take before administration? A. Document the medication administration. B. Perform the rites of medication administration. C. Ask the client about any known drug allergies. D. Explain the medication's purpose to the client. Answer: C. Ask the client about any known drug allergies. This question tests the LPN's understanding of medication safety protocols, specifically regarding client identification and allergy verification. Before administering any medication, it is critical to confirm the client's identity using 2 identifiers and to ask about any known allergies to prevent an adverse reaction. While explaining the purpose and documenting are important, verifying allergies directly impacts immediate client safety before the medication enters their body. The rites include verifying allergies, making this a focused step within the rites. Question 28. A client with a long history of alcohol abuse is admitted to the hospital. The LPN notes the client is tremulous, irritable, and reports nausea. Which medication would the LPN anticipate administering based on these symptoms? A. Lorazepam, Ativan. B. haloperidol, Haldol. C. Naltrexone, Revia. D. Disulfiram, Antabuse. Answer A. Lorazepam, Ativan. This question assesses the LPN's recognition of alcohol withdrawal symptoms and appropriate pharmacological intervention. Tremors, irritability, and nausea are common early signs of alcohol withdrawal. Benzodiazepines, such as lorazepam, Ativan, are the first-line treatment to manage these symptoms and prevent more severe complications like seizures or delirium tremens by depressing the central nervous system. The other medications are used for different aspects of substance abuse treatment, not acute withdrawal. Question 29. An LPN is teaching a client about collecting a clean catch midstream urine specimen. Which instruction is most important for the LPN to provide? A. Collect the first urine that comes out. B. Cleanse the perineal area from back to front. C. Start voiding, then collect the middle portion of urine. D. Collect urine from the toilet bowl after voiding. Answer C. Start voiding, then collect the middle portion of urine. This question focuses on the correct technique for collecting a clean catch midstream urine specimen, which is crucial for accurate diagnostic results. The most important instruction is to have the client start voiding a small amount first to flush out microorganisms from the urethra, then collect the midstream portion. This minimizes contamination and ensures the specimen represents the urine within the bladder. Proper cleansing, front to back, is also important but happens before voiding. Question 30. An LPN is caring for a client with a peripherally inserted central catheter, PICC, line. Which observation by the LPN should be immediately reported to the registered nurse, RN? A. The client reports mild discomfort at the insertion site when arm is moved. B. The dressing is intact and dry with clear drainage visible. C. The client's arm circumference above the insertion site has increased by 2 inches. D. The nurse successfully flushes the PICC line with 10 milliliters of saline. Answer C. The client's arm circumference above the insertion site has increased by 2 inches. This question assesses the LPN's ability to recognize signs of a potential complication with a central venous access device, CVAD. An increase in arm circumference above the PICC insertion site can indicate deep vein thrombosis, DVT, a serious complication of PICC lines. This finding requires immediate reporting to the RN for further assessment and intervention. Mild discomfort or clear drainage, if minimal and expected, are less concerning, and successful flushing indicates patency. Always be alert for signs of circulatory compromise around central lines.